when you're moving from place to place, place. Good morning, good morning, morning, good morning, morning.
And we are back. We continue this morning with our interview with Dr. Ayanna Sebro. She's a technical director of the NACC Secretariat. Good morning, Dr. Sebro.
Hi, good morning.
How are you
Thanks for
this
having me.
morning?
I'm great. How are you?
I'm fine, thank you. Very excited to hear what you have to tell me about the national policy on HIV/AIDS this morning.
Happy to share. Um, at this point in time, the National AIDS Coordinating Committee is finalizing the national policy for HIV. We're coming to Shore Park in Shore Park Complex in Tobago on the 14th, and we are going to be there between 8:30 and 2, coming to hear from Tobago how Tobago would like to help us refine this national policy. The national policy, sorry, is is going to be the main document to help us guide or provide governance to the whole HIV/AIDS response. It's going to give us information around prevention, treatment and care, advocacy, strategic information, as well as that whole governance and how we move forward with governance, how we do resource mobilization, human resource, all of those wonderful things that we need to end AIDS by 2030.
All right. So we know that the event takes place tomorrow at the Shopper Complex, as you said, right? So we want to be a little bit prepared, those of us who would like to attend, given that we can, and we'll get on to that in later on in the interview. But we want to discuss a little bit about the policy itself, what the policy is, what we can learn about it right now to be prepared for tomorrow's event, right? So we'll start off first with what exactly is a policy.
So a policy is a national position essentially in terms of how we're going to do what we want to do. So for example, in our policy we set out goals and objectives for HIV/AIDS response that will guide us over the next 5 to 10 years. It will outline it will outline the roles and responsibilities of various stakeholders that we would outline in the policy, and it will help us now, for example, give us some meat around the how. So for example, we want to prevent HIV. How do we want to prevent HIV? And who do we want to do some of the things that we outlined? So if you go to nacc.gov.tt, and you go to our events page, you will see how to register and how to download the policy. Under the areas of prevention, you will see, for example, that we talk about combination prevention, which would include education, use of medication to prevent transmission of HIV, as well as other things in terms of, for example, how we may want to look at other sub-policies that will help us. One, for example, thing that we would do in terms of prevention, or that we have been doing for years, is we have a policy that we would test all our pregnant women for HIV so that we can intervene. And because of that particular policy statement, we have seen the marked reduction in transmission of HIV to our nation's children. So those are the types of things that you will see. So the policy is really our national statement, or our national forward statement in terms of how we will end AIDS by 2030, what will we do, and what will be the things that will guide us.
All right. So we know that the NACC is in charge of this initiative. So we'd like to know who the NACC is and what is their active role in making the policy itself.
So the NACC is the National AIDS Coordinating Committee. And as the name suggests, we get involved more so with coordination than so with implementation of particular activities. So the organization supports many of the implementing agencies behind the team. We would be the team responsible for collating and supporting the Global AIDS Monitoring Report. we would be the team responsible for the development of the national policy as well as the national strategic plan. I mean, we're here in Tobago just in July, getting some feedback in terms of what that would look like. We would also be responsible for supporting some of the collaborative behind the scene efforts. So, for example, one particular team would lead on, for example, testing. As you know, a lot of testing would happen from the MOH perspective, and there would be collaborative efforts between, for example, the Ministry of Health or certain NGOs. One large collaborative effort that has been recently implemented, for example, is the National HIV Helpline, where, for example, you have several NGOs supporting the helpline to facilitate persons coming forward to access services of various agencies. So the NACC is really a coordinating agency, supporting monitoring, evaluation, resource mobilization, those types of things to help support the response and really help us as we aim to scale up the response to get to where we want to go.
All right, so thank you. So we move on to how the policy is made. How is this policy made?
Okay. So this policy has been in the process for a couple of years. So this would be an output of the first NACC in the first instance. So the first version of this policy. But so we would have had several interviews so we have that first document, but you would have had several key informant interviews, focus groups, studies, research that would have been done to inform the policy. The policy would have been refined. We have a committee that looks at social policy in government, and so that a version of the policy would have been refined by that policy. And so once we came up with this particular draft, the draft was submitted to cabinet and it became a green paper. So what you see when you download the policy, or you see some of the elements of what is in the policy at this point in time, is a result of the contribution of many persons in Trinidad and Tobago, some of our external partners as well over the years. And so this is where we are, and we're at our final stage. So cabinet has seen the green paper. So that the fact that it's called a green paper reflects that we have submitted the document to cabinet in the first instance. And now we're on the home stretch. So we're going back out for our last round of consultations. We're doing a review again of the situation analysis and getting feedback from all of our stakeholders across the country to try and see if we can get a last version now for the white paper. Of course, once this policy is implemented, the intention will be to continue to monitor the policy as we roll the policy out to see how we would need to update the policy to be able to better support implementation. But this policy is a reflection of many years of work and the views of several stakeholders.
Right, so Dr. Sebro, you mentioned a few times the green paper. I realized that there was a progress from draft to green paper, and now you're mentioning the white paper, right? So because it's green paper at present, that is what you have mentioned, we'd like to know what exactly is the HIV policy green paper? What is a green paper?
So the green paper really reflects policy at the point where, for example, we have submitted to cabinet. So cabinet has seen this green paper. So they have seen the policy, we've submitted it to government, and government has seen the policy, and so they have approved this version of the policy. But for it to move from where it is for that to the final white paper stage, we have to get wider consultation. So it's almost like an additional check to make sure that we have everything that we need to have, and we have gone out for wider consultations, and then we amalgamate or bring together all of the feedback we get on this policy and create a last draft, and that will be the white paper.
Okay. And you've mentioned as well that it has been in the making, right? Because for it to reach green paper status and now moving on to white paper, it would have meant that the NACC has been working on this policy for a while. So could you tell us how long and how was that progress for you?
So I would not have been engaged from the beginning. It would have started around 2010. as I was mentioning, the first NAC would have started working on this policy. The NAC has gone through various iterations of itself. And so the policy really has been carried and handed over. And in this version, we intend to get this policy completed and implemented in this time. So the NAC would have, in 2010, would have started working on this. They would have done situation analysis, interviews, engaged with the public, engaged with stakeholders, engaged with technical persons. We would have gotten support from USAID through PEPFAR for some of this work. We are currently getting support from the Pan American Health Organization and UNAIDS to support the finalization of this policy, as well as the new national strategic plan. So it's really been more than 10 years in the making.
Okay, and for this to be progressing that much, we know that it is an important policy. So before we take our break, I would like you to answer why the policy is so important. Why is the policy important?
The policy is important because it's going to help us get to where we want to go in terms of ending HIV. Or ending AIDS for Trinidad and Tobago by 2030. It's gonna give our teams the guidance that they need to move forward. So, for example, we've made a policy decision to treat everyone. We've made a policy decision to test all our pregnant women and treat all our pregnant women to prevent transmission for those who test positive. We have to make some decisions about education for our young people. We have to make some decisions about how we support vulnerable young people. And we have to determine what is the investment that we want to make. So this policy is going to help us now mitigate or prevent HIV infections. 60% of young women in Trinidad and Tobago know how to prevent HIV. That's too low. So we need to figure out what policies we need to put in place to raise that number, so we can be sure that we can keep our numbers low and get to where we want to go in 2030.
All right, Dr. Sebro. So we are in the meat of the matter in terms of this policy, but we take a short break and we'll continue right after the break. Before we go, remember to share the live, share the live, share the live.
Put a smile on your face when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
And we are back. We are at present speaking with Dr. Ayanna Sebro, the Technical Director of the NACC Secretariat. She's telling us a little bit about the national policy on HIV/AIDS. So, Dr. Sebro, we were just talking about how important the policy is to the general public, to our government. So we'd like to move on to if the consultations are actually open to the public. You've mentioned that we have a big role to play. So how do we help out in this policy making?
So where, for example, if you have persons can go to the nacc.gov.tt website on the events page and register for the consultation at Shore Park tomorrow, as well as you can check out our social media pages and come tomorrow to be able to support the consultation and give us feedback in terms of what you would like to see in the policy. What decisions do we need to make? Specific policy decisions for Tobago, or make sure there are particular line items in terms of how Tobago would implement or how Tobago would be supported. All of these things are important, so we would welcome anyone to the consultation tomorrow.
So do we have to be there in person? Is it a physical consultation, or we can log in virtually?
It is a physical. This is a face-to-face. The last consultation we had for Tobago was virtual. We are going to have a face-to-face in Tobago. So members of the NAC will actually be in Tobago. So we have a contingent that should be there this morning, and then you have the rest of other members of the NAC who will be in there, who will be coming in later tonight to support this consultation. So this is going to be face to face. We will have a national virtual consultation because we do recognize that everybody doesn't like to come in person, and we have variants in our audience. But this particular consultation is face to face. So we invite you to come out and
So
spend
that
the day
is
with us.
tomorrow at the Shore Park Cultural Complex from 8:30 to 2 p.m. Yes? So,
Yes, yes.
okay. So the consultations, um, why is the public being involved so important? What is the importance of the public being involved in the consultations itself?
So this it's important for the public to give input because this is not the policy of the NAC. It's not this is a Trinidad and Tobago policy. This is going to impact lives. So what we are asking members of the population to come forward to look at the policy, see if you see gaps. This is the time to say this is missing. You didn't consider this area. This we've tried this doesn't work. Let's try it this other way. This is the time. In addition to which, for example, as we move forward with our HIV response, there are new things that are coming to the front that are important in terms of climate change and disaster and risk mitigation around some of those things. And what are the decisions we need to make in implementation as we think about a twin island state to be able to support persons who may be living with HIV, for example, we may make particular considerations around, for example, how machines might be placed, or if we're resourcing, how we might need to resource and store certain things so that people we have resources to be able to mobilize a response or be able to maintain persons on medication. We do know, for example, that people living with HIV do not necessarily access their HIV treatment where they live. So, for example, if there was the sea bridge is down and somebody accesses their medication in Trinidad, how do they get their medication in Tobago, and how is that process seamless? So, in terms of the relationships that we forge and how we support our clients at the end, because we want to make sure that we have a policy that puts people first. Those are some of the things that are important. We need to be able to hear from the public what are the things that we need to put in our policy to be able to support persons who might be living with HIV, persons who may be affected by HIV, and just general HIV prevention. So the
Right.
public, we won't know unless you tell us.
So that is where we come in. We give you what the public is saying, basically. As part of the general public, we are able to tell you what's happening on the ground. So that is all important in the
Yes,
consultation. All right.
yes.
So
But
for those of us who like to do our homework, right? Those of us who would like to attend the consultation tomorrow, is the policy available to the general public? And where can we find it if it is?
if you go to nacc.gov.tt on the website, right where you register, there's a link to the policy. So you will get the full policy if you go to that event website. We also, if you want to go directly to the policy and not go through the events page, we also have a documents page on the website, and it's reflected in there. So you can download the policy from the website of the National AIDS Coordinating Committee. And again, it is nacc.gov.tt, and we invite you to read policy and to see the different elements in the policy. I would have shared, for example, that the policy is split up into 5 areas: prevention, treatment, care and support, human rights and empowerment, strategic information, and coordination and relationships. And that last one is a big one because if we don't work out some of those things, some of the other things don't get done in the way that we would like them to. So please download the policy and come out tomorrow to the consultation.
Okay, and going through the policy, well, I took a look at the policy. There is a Vision 2030 that you've mentioned from before when we were speaking before the break. Could you tell us a little bit about that vision? What is the progress of that vision right now?
So, so in terms of there's Vision 2030, which is the National Vision 2030, to which all policies and all plans would align for Trinidad and Tobago, because we support that one vision for us, for Trinidad and Tobago. Within the HIV/AIDS response, our goal by 2030 is to end AIDS in the way that we know it. And what does that really mean? So, at this particular point in time, we know that for persons who are living with HIV, if they are supported on medication and they take their medication properly, the possibility of transmission is negligible. So we have a significant opportunity. If we can get all the persons who are HIV positive to take medication and to take medication properly, and which this is in two ways. It is going to be able to impact on persons' lives. Persons living with HIV being able to access medication in the first instance will be able to live a normal life, and be able to continue to interact and and not be ill or anything like that, in the same way as they would if there is no medication. So that is one. And then the other part of persons being on medication is the fact that our new cases of HIV will go down significantly. And so this is what we want to achieve. We want to make sure that we do not miss the opportunity to get everyone who is HIV positive, who has become HIV positive, to be on medication, and to give people access to medication almost as immediately as soon as we know it. We put you on medication so that you can have a good quality of life, as well as we can prevent disease transmission further. Where are we? At this particular point in time, we are programming for between 11 and 12,000 persons who we believe to be living with HIV in Trinidad and Tobago. We have over 7,000 people on medication and just over 6,000 persons who would have achieved that viral suppression rate or treatment success, to put it simply. We do know that for our survival rates are very good in Trinidad and Tobago in terms of our HIV/AIDS program, and so we have about 80% of our cohort we track 5 years out, so for our reports, but so our 5-year survival rates are very high. But we do note that we do have a cohort of persons that we need to support additionally for them to stay in care.
Okay. And well, you've mentioned you touched a little bit on the statistical data, where you mentioned that we are curbing the way we test and stuff like that, in terms of medications and these things that are more accessible to the public now. Our rates are decreasing. Could you expand a little bit more on our statistics, and we'll wrap up using this question.
Okay, so where we are at this point in time is that our rates are decreasing. We're at a point where we're almost in some groups there's a bit of a plateau in that they are holding and they're not going up and they're not going down. When we look at the overall rates, the rates have gone down in terms of the incidence for HIV. But what we do notice that when we start to split it out by age groups and by genders, we're seeing different trends for different groups. And so this is concerning, and we have to be able to, in this new plan and this new way forward, we have to make sure that as we review our data, that we can identify what is happening with each particular group, so that we can ensure that the young persons are aware, for example, of ways to prevent HIV, and that they are preventing and they're doing accessing the services to support the prevention of HIV, so that we don't see rates going up in this particular group. We also need to be aware, for example, and we are paying attention to the fact that we are seeing differences between what's happening between our men and our women, in terms of the access to treatment, as well as the access to testing. So, for example, I could tell you in Tobago, the numbers that I have seen, the testing rate is more or less the same. It's not gone up, it's not gone down. It's more or less in the same area, and more women test than men test. But for the persons that test, more men are testing positive than women are testing positive in the same group. So those things are important for us to pay attention to. People do move to test, but these things are important for us to pay to these things are important for us to review so that we know how to support the population in different ways with education as well as access to testing services and treatment.
All right. Thank you, Dr. Sebro, for that information. Thank you so much as well for joining us. I'm just going to remind our viewers on your event, the event tomorrow at the Shore Park Cultural Complex. The event starts at 8:30 and finishes at 2 p.m. tomorrow, September 14th. Right? We can go to hear more about our national policy on HIV AIDS with Dr. Sebro and team. Yes? Thank you, Dr. Sebro, once again for joining us. And for those of us who might be interested, once again, we can find the national policy on HIV AIDS on the nacc.tt.gov website. And just to do a little bit of homework before we actually attend the event tomorrow, right? So thank you again, Dr. Sebro.